In every single treatment room, every single room that we have one of these. It's called Attitude. Are you familiar with Charles Swindoll?
Just what we learned this morning.
Yep. Did Dr. Bush read this to you already?
Yes.
Okay. So I'll send these back with you. It's amazing though that, you know, when I hire staff and I always give them one of these and I always tell them this is true. This is exactly how life is.
Thank you.
And I would suggest that you put it up in every room. You could do it however you want, but believe it or not, my father-in-law had them like this, so it was just kind of like a thing that I never wanted to change how it looked because I can remember working with him and they were in every room. Okay, so we're going to go to page 22, and it's staff attitude and appearance. And I share with reading with you guys. So when you work for a first-class healthcare facility with a successful caring doctor, you must reflect this in your actions, words, and appearance. If you had a difficult morning prior to coming to the office, you never discuss or indicate that in any way. So I always tell my staff, tell my children, let's just say, and I'm going to use, people don't like this very much, but let's just say before you come to work, your dog gets killed, but you're still going to work, okay? You need to just leave that at the door and come in and because you carry those emotions with you when you come in. And I know it can be painful, but you don't want to come in and discuss it with everybody at the office, because what happens then, pretty soon it just starts infecting everybody. And that gloom and that sadness that you have will just start infecting. And then patients will wonder what's going on, and you don't want that to happen. Have you ever gone somewhere and you just can't put your finger on it? Let's say you went to another doctor's office, or let's say you went to a dentist's office, or even like the mall and you're shopping. Have you gone into a store and you're shopping and you're like, I just don't like it in here. I'm just getting a bad feeling in here. And you leave. If you can't put your finger on it, it's somebody at that facility. It doesn't matter if it's an employee, but it's somebody that's working there that is actually putting that off. And it could be something like there was an incident before work, or you got in an argument with your spouse before work. You cannot let them bring that into the office. Now, if during the lunch hour, for example, if they want to go out and talk about that, they can. But this is something we just really are strict about, because if your patients feel it, that's when you start to have problems. Okay, do you want to read the next paragraph? Kim?
Patients are in your clinic to get well mentally and physically. They need to see and hear upbeat, healthful acting personnel. If you are not feeling well, keep it to yourself. If a patient should ask you about not feeling well, just deny it or downplay it to the minimum. You are to set a good example of health.
That's another thing. So let's say your staff, or let's say even yourself, you don't feel good one day. You do not want to be in the clinic because people come to you because they want to get well. People come to you because you're successful. They feel as if you can help them. If you're talking to your staff or acting like you're sick or complaining about a headache or your back hurts, they don't want to do that, because they're there because they believe you can help them. So you want to make sure your staff isn't complaining about being ill or headaches. Again, they need to keep that to themselves until they can get with you. And what we normally say to the staff member, if you're having a migraine, you need to get a treatment. And if people hear that you have a migraine, they're going to start thinking, well, why does she have migraines? She works for a chiropractor. Does that make sense to you guys? Mm-hmm. Okay. Doctor, would you read the next paragraph?
Be seen smiling and energetic about the patient, about the doctor, about the care, and about your part. Speak with a tone of knowing and authority and at a level to be heard and understood. Proper grammar is a must. Stand erect. Clean nails are a must. Keep your hands to your sides or behind your back. Crossed arms, hands on the hips, hands in the pockets send out a negative message.
Okay. And this is something when girls first start with me, I always have to go through this with them. And this is something that I had to break myself, because we're all animals, would you agree? And our body language says what we're thinking about a patient. It also says what we're thinking about ourselves and about who we work for. So let's just say you're standing there and you have your lab coat on and you're just leaned up against the wall waiting for the doctor to tell you what to do. What's that look like? Does that look like?
Not lazy, but
Yeah.
not involved.
Right. Indifferent.
Indifferent. That's
You
it.
don't really care if you're here or not. So patients see you in the lobby or they see in the room, your staff standing up against the doorway waiting like this. You're not there to serve. It doesn't look like you're there to serve them. It doesn't look like you're excited. It doesn't look like you have good health. So what I do with all my girls and myself, believe it or not, after all this time, I still hold my hands like this behind my back. You never ever want to stand like this around a patient or around anybody really, because let's say you're at church and you're standing like this. What's that tell a person? That says I'm closed to you. I don't like you. I don't want anything new from you. I don't want to experience anything with you. Now, with patients, you have to understand too, when we're going through everything, Dr. Bush touched on ARC. What does this tell the patient? I don't really want to help you. I'm still going to be a doctor in the list of the 9 doctors that you had before me because I don't care about you. But now if you're standing like this, or if you're standing like you're ready and your staff's ready, they're thinking, they can't quite figure it out, but they know they seem different than everybody else. It's because you're excited, you're there to help them, you're not slouched, you don't have your hands in your pocket like you're an old maid, you're ready. So that's why your staff does need to work on that and make it a game. Don't make it like, I'm gonna hit you with the fly swatter every time you put your hands in your pocket, but just explain to them, I'm working on it too. So if you see me doing it, do you guys do that at all?
We don't make it a game, no ma'am.
No, I mean, do you feel like you ever do that? I mean, everybody.
Oh yeah, I've
Oh,
caught
I'm
myself
sure we
doing that.
have, but
Yeah,
from a front desk standpoint, we're typically at the front desk. I mean, because we don't have to move around a lot in our current office. Because we have a second,
Yeah.
we said we had other staff. I mean, the boys are part of our staff too. but
Oh, well, that's
both of our
exciting.
boys are in there running
That's
the
nice.
tables.
Yeah,
That's
their
great.
job
So-
is just to clean tables and get ready for the next person.
I
So they're
love
taking
that.
patients back. So
That's
normally we're
great.
so busy at the front scheduling and checking patients out and things like that. I mean, we
But I have
do
to be
make
very aware of my body language.
Yeah.
so we're normally there like receptive, and then when a new patient comes in, we're ready for them and stand
Good.
up, and so I don't really
Good.
know
I
that
typically find myself doing this
Yeah,
yeah.
here.
yeah,
And what this is usually like, you're talking too long. I got 3 more people. Let's go. I gotta.
Yes.
Let's go. Let's go. Let's go. Let's go.
or they're thinking, do you want my money?
That could be.
They're thinking
That's
that.
usually what's on my head though. It's like, okay, you need to
Yeah.
stop. Come on, let's go. We gotta go. I'm getting nervous.
I would just make it a game for you guys, especially for the lady who works with you, because I want this to be a good experience for her. Not like, oh gosh, you're changing everything in our world. Just make it more fun. That's okay. You are the doctor's assistant, and you are not the patient's assistant. You are not the patient's best friend. The doctor's directions and orders are always followed. The patient never dictates care, appointments, and never is given any indication that they could dictate care or number of appointments. Now, this is an example, especially when you are following our protocol. If Dr. Bush says the patient needs to be seen next Tuesday, I want to see him before he goes on the table. If you have a close relationship with your patients and you're out garage sailing with them and you're going to lunch, or let's say you have a staff member, you don't want staff members to become friends with patients, because this is what happens. Then the patient goes to the front and, Betty's checking out, or Susan's checking out Betty, the patient. And she said, yeah, but we have to go to that garage sale. So I don't want to go Tuesday. Remember, we have plans already. Well, that staff member is automatically going to do whatever the friend wants, which in turn is saying it doesn't matter what you said. So you need to watch interpersonal relationships with patients and really move away from them. Also, collecting any fees from them then when you're friends is very difficult. You're more likely to have somebody go, oh yeah, just bring it next time, which you do not want.
Yeah. I mean, that's definitely not a problem.
That's
in
good.
our office, so that's good.
Yes, that's good. I've had places though where it was. Okay, you can go next, Kim.
Be positive and meet any negative statement from the patient with a positive reply. In this way, you are not supporting or planting any negative ideas in the patient's mind.
So this is one thing I would suggest that you do. And again, you guys may have a lot of this, you feel like already you do, which is great. It would then just be re-cementing it for you. But you want to go back home and you want to make a list of the top 20 things that your patients will bring through the doors. It could be, like ours will be, your parking lot is so busy. You're so busy. I couldn't find a parking spot. You need to write them down. You need to have patented answers off to the side. You need to have patented answers that you distribute. Just a list of, it's raining, I hate the rain, it's getting ready to snow, I hate the snow. You will have lists then with typed up patented answers. So you're going to take any negative, the top 20 things that a patient will come in and say, you're already going to have the answers on a piece of paper, and your staff needs to memorize those. So for example, ours example, it's just raining all the time. It's great for the ducks. My flowers love it. They know what to say. My staff, gas prices, that's a big one. We do have to move that around. We've had to say everything from, you know, I'm just happy I live in a small town. We don't have to travel that far, or, you know, I support the military. We come up with different, you need to come up with those answers too. Just get them ready where everybody says the same exact one. Because people, unfortunately, want negativity. You need to stop it at that very beginning. You'll be amazed. You won't get a lot of it if you just start heading it off. Okay, your turn.
Teamwork is essential. Staff member needs to be willing to be cross-trained. Each employee is a crucial part of the foundation of the clinic. Do everything you can do to cooperate and perform the daily work in a scheduled manner. Be willing to do more. Respond to the doctor's request with, quote, yes, doctor's name right away, end quote. Always verbally respond to any staff member. Acknowledge verbally the request and what your next action step will be. Even if you're not able to comply, you are a positive and pleasant in every way.
So I always give this example to my staff. Okay, and we have to actually go through retraining on this, because human nature is, you get busy, you get into yourself, you think you're the most important thing ever, you're the most busy person ever, so then you may not respond back to your staff member. So let's say you're in another room and I say, Kim, will you bring me a pen? And we talk on headsets a lot. Or let's just say I'm in another DRS room and I say, Kim, will you bring me a pen? Now, at that point, you need to say, yes, I will bring you a pen, Jennifer. Because what's going on is you're not in present time consciousness then. You're with the patient. You don't know if Kim's going to get the pen. You're focused more on it, going to get the pen than you are on the patient. And when you're doing hookups on tables, and these are real life serious things, and I consider them to be life or death, truthfully. I mean, you have to really pay attention to what you're doing. So communication back. Also, then if you, like I always call Dr. Bush, because I want every single person to respect what Dr. Bush has to say. If he tells a patient, I need you here Tuesday, or I need you to start doing the exercises, because the way I respond and the way my staff responds to Dr. Bush, they will do that. It's how we react to the doctor. So you guys have a great relationship, so you don't have to probably worry about, you don't have the problems that some people do. But how, when you're husband and wife and you work together, it's just like what I tell myself in the morning when I come here is I just put on a different hat. I have many different hats that I put on. And by the time I get home, I have to throw all the hats out, and then I got to put on the mom hat. And the same thing with your kids when they're working with you. These are things that you'll just need to train them to say to you. People sometimes will say, why do you call your husband Dr. Bush? Oh, because we're at work. Just works better that way. Also, if you have staff members that are not responding back to other staff members, explain to them how that can cause chaos, especially the busier you get. They need to definitely be in communication. And then we're going to also show you nonverbal communication that we have and how we do that, so you know how to do that within your office. Okay. When speaking with patients, have a positive attitude about the doctor, about the clinic, and care. Occasionally, you will have an inpatient patient. Listen in the following and correct responses. Okay, I can say, since COVID, people are impatient a lot. So these are great responses to have back, because I don't know if it's the vaccines. I have no idea. But your staff members need to memorize these and use these at every time they're questioned, because the patients aren't going to see you every single visit. Even though you'll be there, but keeping control of your book and having your staff keep control of the patient is important. So having them know these things, patented answers. So I'm going to have you both read them. Okay, so Betty is the patient. So Betty, I'll read this one. Dr. Bush would not have accepted you for care if he did not feel he could help you. Now, this is what happens. Sometimes patients want to see the doctor every visit. So when they're coming for the DRS protocol, Dr. Bush has them do certain numbers the first 2 weeks, second, third, fourth. And he will not see them every single day. He'll see them after a certain amount of time then. Sometimes you get a patient that's just hooked on seeing the doctor, and that has to do with how they are. You will want to make sure that you know these, so you'll be able to say to the patient, Betty, Dr. Bush knows exactly where you are in your care. He would have never accepted you for care if he didn't know he could help you. Now let's just say Betty went out over the weekend and she decided to cite a pole burn, but she didn't tell you about it. And she came in and it's Monday and she's like, I am so sore, I can't even walk. I didn't do anything. I swear I didn't do anything. And then you start digging and you start this, and she hauled stone and she put up siding on her pole barn. That's where you need to be able to use these. Like Betty, and you'll just go through these. So we'll go ahead and start reading them too. I just read the first one.
Betty, as you know, your condition didn't happen overnight, so we cannot expect it to be resolved or be corrected overnight. However, you did say you were and review whatever improvement the patient has reported.
And we'll come to that because we have every day a patient has to authorize a progress report that will show their improvement, and that will show you what that is in the file. So now let's say Betty comes in, you can actually flip it open to progress, and let's say it says 80% on Thursday. Now it's Monday and they're saying, I'm back to 0. Okay, but Betty, you were 80% on Thursday. Yes. Okay. Betty must comply with all parts of the treatment plan and follow all Dr. Bush's recommendations for your maximum improvement and benefit. So that would be for anything from icing, that would be exercises that Dr. Bush will give, that could be, wanting them to slowly start vacuuming their house again. So you need to, make sure you're reinforcing those, because sometimes patients don't want to do exercises. I'm sure you've experienced those. You have to make sure your staff is reinforcing that. Okay.
Betty, Dr. Jones has dedicated his life to treating patients with severe back problems, and you need to follow all of his recommendations.
Correct. Betty, Dr. Bush has dedicated his life to treating the sick and suffering.
Betty, nothing pleases Dr. Jones more than a difficult and challenging case.
Because everybody that is chronic, which you went through, I'll go through feels as if they're the most challenging case. You need to reinforce this is exactly what Dr. Jones wants. He loves to help people that are difficult. We can help you. Okay? Go ahead.
Betty, Dr. Jones is wonderful, and he is always aware of your progress and situation. At any given time, he knows where you are in your care. I will talk with him, and if Dr. Jones feels he needs to see you, he will schedule an appointment. We will schedule an appointment with him on your next visit. Okay, so remember how I said sometimes patients are addicted to the doctor and they want to see him all the time. You don't want to mess with the doctor's book that day. So you could say, Betty, I went and talked to Dr. Jones, and Dr. Jones said he wants to see you tomorrow. We'll put you in at this time, and then we'll put you on the table after that. But it's on your terms. The patient didn't win that battle. Does that make sense? You can't let him do it. Okay, when talking with a patient, always emphasize that they're doing a good job. Excellent compliance, effort, and they participate and invest their time and efforts into their care. We acknowledge their participation every visit. Remember the day when you interviewed, that was somehow I got mixed up. Why did that go right there? Oh, okay, this is for I'm sorry. This is for the staff, I was still up here. Okay, so with our staff, with our patients, every single day I make sure that the staff tells patients that they did a good job. Because a lot of the patients that come, most of our patients are chronic. They're in bad marriages. They have problems because they are chronic patients. I want them to at least hear at our office that they're doing a good job.
that they're doing the right thing, because that keeps them going, because it is a big deal. They got up, they came into our office. So every patient every day gets to hear they did a good job from our staff members. Okay, and you want to make sure too that your staff continues to, you ever interview somebody and they look really nice when they come in, and then after that they come in and their clothes are wrinkly and it looks like they just got out of bed?
Well, that's not necessarily clothes, but I was thinking of Stacy.
Oh, yeah.
The person that I
Yeah.
interviewed and hired was completely different than the person that it ended up being.
Oh, that's funny. I've had it happen too.
Not normally. Normally I can pick them out, but that one I just completely crashed and burned them. She was great with the patients. I mean, patients loved her, but
Well, of course they loved her. I
But-
know why.
she's still a little different.
If whatever color you are going to choose for your office, scrub wise, just make sure everybody, like we have gray. Make sure they're nice. They're not wrinkled. You know, anymore they make them non-wrinkled. I mean, we used to tell people white shirts. Well, underneath their scrubs, yes, only white, black, or gray shirts with ours, but no designs ever, because everybody at least needs to look somewhat uniform. We got away from white shoes because, you know, after COVID, they needed their own individual. Now it's just whatever shoe they want to wear, as long as, people, staffing, like, so as long as they're not like, what are the Vans or something, but they can wear whatever shoes and socks they want to now. The younger generations,
So for busy work week, uniforms. Question 1, do you purchase uniforms for your staff? And question 2, how many uniforms are they required to have?
we do not purchase for our staff. We will have them embroidered, but we will not purchase for them. And then I always tell people, because anymore, to be honest, you don't know how long someone's going to work for you. So I tell them during the interview, you can go over here to this place, but they do offer a 20% discount if you work for us. If you can only afford to get one set, that's fine. You just need to go home and put them in the dryer and freshen them up every day. I then make them come back to me and show their scrubs to me before they start working. If they don't come back and show you the scrubs, keep interviewing. That's exactly. Because they need to get some skin in the game too.
Makes sense?
Healthy breath, healthy smile. Now, I don't push them wearing makeup, because not everybody can wear makeup. Like I don't require it.
Yes, ma'am.
So, okay. There are certain words that we do not use, and instead of sign here, and we're gonna watch videos on this too. We're gonna go back, you're gonna hear things twice, but I just like to go through it with you. Instead of sign here, we only say authorize, check in here, or signature right here. And do you have digital x-ray, or do you have?
We do not have X-ray in our office. We use a local facility.
Okay, so we don't need to worry about that. And instead of pay, no one pays or no one is charged. You always want to say, fees are handled today. Fees are taken care of the time services are rendered. We can take care of your balance, and we accept cash, check, and major credit cards. We never ask a patient, how are you? And the reason we don't do that, is because if you have new patients in the lobby, if you have patients that are getting better in the lobby, and all of a sudden you make the mistake and you ask, how are you? You're gonna hear everything from their dog died, to their husband left them, to now their back hurts. Of course their back hurts, because there is a emotion component to that. But the new patient over here and the other patient that just started care, they don't know that. All of a sudden they're losing faith in what you're doing. So only people that are allowed to ask a patient how they are, and it is behind closed doors, is Dr. Bush and the people that are hooking up on DRS. That's it. Now this was a hard habit to break for me when someone would say, how are you? I always wanted to say, great, how are you? So now I just say, wonderful, what a beautiful day. Even if it's raining, I say it. So just come up with the catchphrase for you and your staff. We give you some, like, it's nice to see you, compliment them, a statement about the weather. This is a big one, and this is a big one we always do in our family, is instead of I hope, I will try, and I think, and I can't, you always want to say, I know, I will inquire, and I will be sure to see to it. So it's just like when your kids tell you, I will try to get my homework done. What's that tell you? They're not.
Full effort.
That means they're not going to do it. So Dr. Bush always says, try implies failure. So when a patient says, I'll try to do my exercises, I will tell them, trying implies failure. You're going to need to do the exercises. So you just have to be more firm with them, and you can correct your patients on their vocabulary because you're helping them. Coming to you is not just helping their back, it's helping them everywhere, spiritually, everything. It's a whole body experience. Okay, a patient says, you are really busy. Yes, we're really busy helping people. That's what anytime you can go upstairs right now and ask any of my girls, you're really busy helping people. But it's natural, it just comes out because you're saying it. You can also say, yes, really busy helping people get well. Mine's just, yeah, really busy helping people. As a patient leaves each visit, you'll always want to tell them, great job today, Betty. Or, and how you want to say it in your version, but I would put on your front desk like a little note and everybody sees it just until you get it down. Good job today. Great job today. Okay. Any questions so far? Nope.
You're looking at me. What?
Okay, so now we're going to watch these. Okay, so you have to know the videos are old. Rachel and I are, oh gosh, we're on a soap opera practically in here. But this is going to help when you're training your staff, actually teach them the categories. This is how I teach my girls. And I believe it will really help you. So like Dr. Bush said, there are different types of patients. An acute patient is what we'll start with. Then we'll go to semi-chronic and chronic. Our practice focuses basically on chronic patients, but we do have acute and semi-chronic. Okay, so this is the first page, and it's about the acute patient.
When dealing with new patients or existing patients, it's important to understand that there are 3 different types of patients. The one we're going to be handling right now is called the acute patient. What's interesting about the acute patient is most of the acute patients are actually males. They're very healthy and active. When they're calling you, it's most likely that their injury did occur that day, and they want to get in that day. These types of patients are on a deadline, and they are definitely price shoppers.
So what happened?
Well, I was gardening, and I just bent down and something snapped. I have no idea, and I don't want this to affect me because I play tennis. So that's why I'm going to call all these chiropractors in this book. I'm going to ask them how much they charge and when they can get me in. And
Don't forget they're going to want to do x-rays.
Well, I'm not going to do x-rays today because I just want to be treated today and better by Wednesday because I have that tournament.
Right. Can't you get into Dr. Smith?
No, he's out of town. Normally he just gets me in right away.
Yeah,
so that's why I'm going to...
One treatment and you're usually fine, so...
Exactly.
Well, I'll help you call.
Okay, great. We're going to ask them how much they charge, and we're going to tell them I need in today, that I do not want x-rays, and I'm on a deadline.
Great. I'll help you.
Thank you.
You're welcome.
Okay, so that is the acute patient. That would be, you recognize a patient like that for a new patient phone call. Then we have a semi-chronic patient. Now, a semi-chronic patient, I want you to remember when you're watching this, it's just one step away from being a chronic patient.
Patient is called a semi-chronic patient. The interesting fact about a semi-chronic patient is most of them are males, and they're under the age of 50. These weekend warriors have usually had 1 to 2 episodes in the past. For an example, they had a condition, they went to see a doctor, had 1 to 2 treatments. Maybe they didn't even seek treatment. These patients want to be seen and get better immediately because they don't even feel they have a problem. These are the type of patients that will come to your office and they have researched what they consider to be their problem without even having a diagnosis. They love the internet and they love WebMD. Do you have any Advil, Rachel?
What for?
Oh, my back is killing me. Do you remember about a year ago when I went to go see Dr. Bruner?
Mm-hmm.
Oh, well, this is just terrible. I don't think it's a big deal. I told Rick it's just the same. I just need to get back in to see a chiropractor just for 1 treatment.
Well, yeah, as you say, last time you only had 1 or 2 and you were fine.
Well, yeah, they wanted me to come back like on a treatment plan, but I just needed 1 or 2 visits because I know my body. And when I heard that pop, I was like, it's, I'm
So much better.
Right.
Right. Well, it's not like we have all the time in the world.
No,
you know, to go
more
to
than
the
money.
doctor. Exactly.
I just want to get it done. I don't want to spend a lot of money. And I'm on my time, not that doctor's time.
Right, exactly.
So can I have that over?
Sure.
Thanks.
Now the next is a chronic patient. This is what your
The next
DRS
patient
patients
we're
will
going
be.
to discuss is the chronic patient. What's interesting about a chronic patient is most of them are actually female. We are seeing an increase in male though. These patients have been seen by many, many doctors and are usually under the care of 1 to 2 doctors while they're treating with you. These patients are actually the ones when you go to a cocktail party, they're standing in the middle of the room discussing all of their surgeries and all their medications. Right away when I see that, I know this patient is a chronic patient. When discussing the care with the chronic patient, you have to understand that they truly feel they have a serious problem. They want someone else to make their decisions for them. They control their spouse and their family members through their pain and through their condition. When you're dealing with this type of patient, you need to understand that your reality for that patient is they have a serious problem because they believe that they are very sick. I'm so happy you came to see me today, Rachel.
Well, I know you weren't feeling well.
Oh, this has been terrible. Thanks for getting my groceries. I so appreciate that.
Well, I know Bob wasn't home.
It's been so hard for Bob. He has to do everything. Grocery shopping, take care of the children. All I can do is sit in this chair and, I cry a lot because I've been, did you know I've been to like 10 doctors?
Yeah?
10.
Oh my gosh.
The next step for me is Mayo. That's where really sick people go.
I was gonna say, you gotta be bad if you're going to Mayo.
I know, I don't know what to do. I keep this list of medications right here in case something would go wrong and the hospital, if they have to take me to the hospital, I'm just so afraid. And I thought about calling and talking to somebody about my other options, but I think that's something that I need to have my husband do for me.
Do you think there are any other options?
Well, I don't know. 10 doctors and let me see, 5 epidurals, 10 prescriptions I take a month. That's like $300 a month. So tired. I don't even drive anymore.
Right.
No, I don't know what to do. And do you want to see my films?
Sure.
They're really bad. These are all my x-rays.
Really?
Yes.
My gosh, there's like a ton of them.
This is all my medications.
You take that every day?
Yes, I know.
Oh my gosh. You gotta find something else.
My next option is surgery.
Again?
That's
You've already
a
had
typical chronic
3.
patient.
Yes, this would be my 4th surgery. And I take a lot of medication, and some of them are very high painkillers, and I'm afraid I might be addicted to them. And they're talking about after that surgery, possibly weaning me off of them. I'm very concerned about this.
Well, yeah, that'd be really, really hard.
I know. So would you think good thoughts for me?
I certainly will, and if there's anything I can do to help, let me know.
Thanks.
That's just like a chronic patient. So Dr. Bush talked about ARC. So affinity, he went through it's I like you, we get along. Reality is, what color is this pen?
He said you would say purple.
Right. But you can't make me believe that it's a different color. Just like right there, that chronic, did you see the difference between an acute, a semi-chronic and chronic? Even the body language of an acute, semi-chronic and chronic. So when you're dealing with these people, you have to get your mind around their reality so that you don't break the affinity, which breaks communication. That's going to be everything from the person that's answering the phone, how they're handling them on the phone, their tone on the phone. I change my inflections. Rachel changes her inflections. When they're talking serious, like, I'm really concerned. Well, I can understand that, Betty. You have to be in their reality. That actually helps them to understand that you're not just one of the doctor's offices that they've been to, the other 9 doctors that haven't helped them. So that very first phone call, you have to know what you're dealing with, because you cannot take an acute patient and term them chronic. You cannot take a chronic patient and treat them acute, or you're going to lose them at that call right away. And not every chronic patient is a true chronic. They might be semi-chronic, where they're in denial. They think, oh, well, this has only happened a couple times. It's not a big deal. They have to get in, and Dr. Bush has to assess that and give them the exam. So you want to make sure you're handling the semi-chronics correctly too. So we're going to go through the new patient phone call. Now we're going to open up book 2. Now we're going to run through what a new patient phone call sounds like for this. You can tell there is a difference with a semi-chronic, acute, patient. So that's going to be book 5.
Book 5.
And when you're dealing with training your staff, I would definitely use those 3 videos. They're corny, but guess what? All my staff knows what an acute, semi-chronic, and chronic patient is then. So this is book 2,
Book 2.
page 5.
Page 5.
It's going to be the initial new patient phone call. We give you new patient confirmations. I can go through that too with you. So we'll do that after we book the phone call. We do the phone call.
Handling the patient from the first phone call is important. The acute, semi-chronic, and chronic patient phone calls are all very similar. They all have the same script. But you have to understand, are you dealing with an acute patient, a semi-chronic patient, or the chronic? That's why watching the previous videos is so important in understanding. You're going to notice in the next 3 calls that we're taking control of the call and we understand what type of patient we are dealing with. After watching this, so will you.
Thank you for calling Bush Chiropractic. This is Elaine. How may I help you?
Yes, I would like to make an appointment for an adjustment today.
Okay, what is your name?
My name is Jennifer.
Hi, Jennifer. I'm Elaine. And what kind of problem are you having?
Well, I hurt myself today in regards how much is the treatment?
Oh, well, you know, Jennifer, we don't even know what is going on with you. You said you hurt yourself. Have you had this problem before?
No.
Let me ask you a couple of quick questions. What does your pain feel like? I mean, you got to be feeling bad to be calling.
Well, actually, my pain does hurt. It burns.
Oh.
But I don't think it's a big deal. I mean, it's just, I bent
Well, I
over.
wouldn't say that. I mean, burning is a symptom. How long ago did you do it? Did you do it this morning or did you do this yesterday?
No, I did it this morning. And
Okay. Did you take any Advil or anything?
Yes, I did take some
And it didn't
Advil.
help you, did it?
No.
For what is your last name?
Smith.
Okay, Jennifer Smith. And what's your address, Jennifer?
17828 Bluffton Road,
Fort Wayne. And your zip?
46718.
And your home phone?
260-471-9923.
And an alternate number, cell or work. It doesn't really matter.
My cell phone is 385-4233.
Now, let me just tell you, Jennifer, I'm going to look for an appointment as soon as possible for you.
Can I
do
get
you
it
work
today?
No, it's not at all possible. But I'm going to look for something. I'm going to move something around for you. We're going to be able to see you at 8 o'clock tomorrow morning. And do you know how to get here, Jennifer?
Are you the one that's by Michael's Photography?
Yes, exactly. You probably even know somebody that's been here if you think about it.
How much is the treatment though?
Well, again, Jennifer, I can tell you about your first visit, which is then we're going to know a lot more about what's going on with you. When you come in tomorrow, we're going to have you come in about 15 minutes early to do your initial paperwork. And then you're going to be seeing the doctor promptly at 8 o'clock. What we would do then is go ahead, Dr. Bush is going to take x-rays of your low back, and then we're going to do a consultation, a neurological and orthopedic exam. So you're going to be here about an hour. And so for the first visit, your film will be 70 and your consultation and exam is going to be 80. So the total for the day is 150.
But when I went to another chiropractor in town, he didn't do x-rays. I just wanted
Oh, I know. Unfortunately, that's so common. But Dr. Bush does, and really you want him to because you do not know what is going on. You say you have burning. It's bad enough for you to call. You want to be knowing what is exactly going on. You do not want to go where they don't take x-rays. Jennifer, let me tell you, then there's going to be visit 1 for your x-rays and your consultation. And then there's visit 2, which is called the report of findings. And the first visit, as I said, is 150 for your film and your exam. The second visit is report of findings. You're going to have a substantial amount of time with Dr. Bush. He's going to go over the findings from your film and the findings from your exam. And there is not a fee for this meeting with Dr. Bush. And then we're going to go on and know exactly what he is recommending for care. And he may not even accept you, although your symptoms do sound like an area that we would take care of.
Well, will he treat me tomorrow morning if I come in at 8?
You wouldn't want him to treat you. He hasn't had time to look at your film. He hasn't had time to go over exam findings. Dr. Bush is a very thorough doctor. This is why he has such a great reputation, and this is probably why you even called here, because you know that he has good care in the community.
Yes, I haven't heard good things about Bush Chiropractic.
Right. Now, what we're going to have you do is just go ahead and come on in at 7:45, bring in your insurance card, we'll go through your paperwork with you, and we'll see Dr. Bush at 8 o'clock. So do you have any insurance?
Yes, I do.
Bring in your insurance card, and then actually, in the case of insurance, it's just really easy. You're given proper documentation the day you're here. It's copies of your receipt. You're going to have one copy for you to send your insurance card and one copy for you to keep to track with. And there's absolutely no problem at all to doing that. It's simple. You just send it in to your insurance company.
So I have to pay you tomorrow?
Yes, the fees
Okay.
are handled the day you're here.
Okay. Well, then I'll just submit that to my insurance company and then they'll send it back to me.
Right, and if there would be any questions along the way, we certainly will help you with that.
Well, you can go ahead and schedule me for tomorrow
Okay.
at 8 o'clock. And then I also might just call around and see if anybody can get me in.
Okay, well, I'm not going to schedule you if you're not firm about being here tomorrow at 8 o'clock. I've made a special arrangement for you to have this 8 o'clock appointment.
Okay. Well, I'll keep it.
Okay, great. You'll be glad that you came here.
Well, thank you so much.
All right, thank
Bye-bye.
you.
Okay, so you can see the acute patient just is trying to railroad. You got to keep redirecting it back to the script. Just keep doing it.
I'd like to schedule an appointment to come see Dr. Bush, please.
Okay, and your name?
Jennifer
Hi, Jennifer. What is your last name?
Smith.
Okay, Jennifer, what kind of problem are you having?
I actually have low back pain. I've had this problem on and off probably about 2 times for a year, and it's really not a big deal. And my husband doesn't even really believe in chiropractic, but I thought, well, you know what? It worked for me one time. I'm going to try it one more time.
Do you want to tell me what your pain feels like, Jennifer?
Okay, so you can see that patient right away. You need to start getting what they have going on. You need to get their name. You need to get what they have going on and have them tell you about their pain. That's right off the get-go because you want to control the call, and that's how you're going to do it.
Well, it's a burning in my low back.
Is it constant right now?
Yeah,
Does
it
okay, does
hurts.
it keep you awake?
Sometimes.
Okay, and does it radiate down into your leg?
No, why should it?
Well, I mean, it could. I just was trying to find out where the area of your pain is. What did you do prior, if you've had this 2 times before?
Well, I went to a chiropractor one time, and I just had one treatment. He wanted to give me about 10.
Okay.
But you know what? He gave me 1 or 2, and I heard this pop, and it was better. And I know my body. And my body said, I'm better. I don't need this
Well, your
anymore.
body says it's in pain today, doesn't it? In your past, did anyone take x-rays with you?
No, I just went to that doctor, and
Okay.
well, you know what? I might have one set,
How long ago?
a year maybe.
Okay, those would probably not be current enough. So let me take you through the first visit. On your first visit, we're going to do x-rays, and there's going to be a chiropractic orthopedic exam.
But I don't want to spend a lot of money. I have Blue Cross. Are you in their network?
Oh, no, actually, Jennifer, we're not in Blue Cross Network. We're not in any network. But that is really not a problem. The fees are handled by the patient the day they're here. You're given proper documentation. It's really easy, Jennifer. You
Everything is
just
easy.
copy
Use
of
that
the
word for
insurance card,
everything.
And you're reimbursed to your home.
Oh, okay.
So going back to what you did in the last year, since you have had this problem 2 times, what did you do? You saw one chiropractor one time. Did you go to your family doctor? Have you seen any surgeons?
Well, I did go to my family doctor, and I also got in a hot tub, and I just relaxed, and
Okay,
it felt
so
good.
he helped you at that time, and then did you find...
You see how we just keep
increased
questioning?
pain afterwards,
You got to
or
keep them
you
engaged
felt
and
like it
bringing
was
up their
worse maybe
problem.
an hour later?
No, not that I remember.
Okay.
You know, it just hurt, and then I got in the hot tub, and it got better, and
Okay,
I'm pretty
so
in tune with
Why
myself.
did you have x-rays taken a year ago? Who took those?
Dr. Smith,
And he is a GP or a chiropractor? Or...
GP.
Okay, what did he tell you your diagnosis was? Did he give
He
you a
just gave me,
diagnosis?
no, he just gave me muscle relaxers.
Okay, did they help you?
Oh, I don't know. I don't
Okay.
remember that day. You know, they might have helped me a little bit, but,
Right.
you know, I told you I'm pretty in tune, and
Right, exactly. Well, what I recommend is that I go ahead and make you an appointment. Jennifer, you do have a reoccurring problem. You're saying that it is burning. It's
Going
keeping
back
you
through what they
awake at night.
said.
I'm assuming, are you taking anything over the counter for it? Are you taking a lot of Advil? Or...
Advil, yeah.
Okay, so, and you felt bad enough to give us a call. What we need to do is go ahead and schedule you for an appointment. What is your address?
17828 Bluffton
Okay.
Street.
Fort Wayne, right?
Yes,
Zip code?
46718.
A home phone?
471-9912.
Okay, and cell or alternate number?
385-4233.
Okay.
And real quick, I don't understand why I need to take x-rays. I didn't have to take
Okay,
x-rays
well,
last time.
this would be the same as you thinking about going on a cross-country trip without a road map. The doctor is not going to treat you without knowing exactly what's going on, and he can't determine anything without x-rays. You would want x-rays, really. Your back, you have had a recurrent problem, you need to have x-rays.
Okay.
What I need to do is go ahead and talk to you again about your first visit or x-rays and consultation. The film is going to be $70, the consultation is $80, so your first visit is $150, and you'll be given the receipts or documentations for you to submit to your own carrier. And that visit is going to last you about an hour. You'll be here 1 hour, and I'm going to go ahead and try to have the doctor see you as soon as possible. I have an appointment for you at 8 o'clock on Wednesday, the 31st.
Yes, that sounds good.
Oh, that's great, Jennifer. And I want you to know that you need to be here about 15 minutes early to go over your initial paperwork. Go ahead and bring your insurance card, because as a courtesy to you, we'll go ahead and call your insurance company and find out what they're telling us about your benefits. And do you know how to get to our office?
Are you the one by Michael's Photography?
Yes, that's correct.
Okay. Well, I will be there. And again, what time?
Your appointment is 8 o'clock on the 31st of Wednesday.
And we always tell them
Great, Jennifer.
the date, the day,
Thank you.
because people remember certain things differently. This
The
is
next new patient phone call that we're going to be dealing with right now is the chronic patient. This is my favorite type of call. Do you know why? Because I can actually really change their lives. As you're going to hear in this call, the patient is very concerned and wants to make sure that Rachel understands all of the places that she's been, all the MRIs that she has, and if her husband can get her there. When going through a chronic patient call, you have to make sure that you're addressing that you know. You can hear Rachel's tone and her voice change. She changes her inflections based to what that patient's reality is. When you're watching the video, listen for the changes.
Thank you for calling the Bush Chiropractic Center. This is Rachel. How may I help you?
Yes, my friend was watching your infomercial, and she told me I should call.
Okay, so you're calling for yourself then?
Yes.
Okay, and your name?
My name is Jennifer Smith.
Okay, Jennifer. And what sort of problem are you having?
Oh, what problem? I'm all sorts
so you
of
want to ask them right
My
away
back
what type of
hurts
problem
so
they're
bad.
having.
Okay, is it in your upper back or your lower back?
My lower back.
Okay, so you have lower back pain.
You can hear Rachel's tone and her voice change. She changes her inflections based to what that patient's reality is. For example, when we're talking about the patient's surgeries or past problems, her tone will be very serious. When we're talking about insurance, our tone goes up. Like it's really easy. Listen for the tone.
And can you describe your symptoms for me, Jennifer, when they're at their worst?
Having the patient recall their symptoms when they're at their worst is a very important aspect of the call. Why is that? Because that patient could be taking pain medication. When they're calling you, they may be feeling great. If they're only masking their problem with pain pills or massage, that's temporary relief. They're not fixing the actual problem. So it's important to make them go back to when the pain is at its worst. Adding that in the correct tone is very powerful.
It's like a hot poker. It's like a hot poker on fire. It hurts so bad in my low back.
Okay, are you losing sleep over this? Is it affecting your sleep then?
Yes, it is. I have to take sleeping pills.
Okay. And
See how
do you
you're
notice, does it stay in one place?
making them
does it stay in your
involved.
lower back, or is it traveling down your legs at all?
Well, yeah.
My favorite to do right now is it in your legs? Has it reached your feet yet or your foot yet? Now you're adding the word yet on the end. What that does is they're like, oh my gosh. That's right now, especially because I don't know if you've noticed, a lot of people have neuropathy now from the vaccine. So that's something that I've added on to the call, and it is helpful.
It does. It travels down into my right leg, and it even sometimes hurts into my foot.
Down all the way down into your foot?
You're also going to hear Rachel repeating back the patient's symptoms and problems. This is important because it cycles the information back through the patient's mind, reiterates to them, you do have a problem.
And I have to have my husband rub my foot at night, and with special oil.
Okay. Does that seem to help your problem, or is it just kind of giving you temporary relief?
Just relief at that moment.
Just temporary relief? Okay. All right. And have you had any x-rays or MRIs or seen anyone about this, Jennifer?
The chronic patient is also going to want to discuss all of their past treatments, all of their past x-rays and MRIs. The patient does want to bring these all to you. Assure them that that is a good way to be. Having them bring more information with them that they want to bring makes them know you care and that you are going to review their entire history. Let them know this by saying, definitely bring them all. The more information that you provide, the better.
I've had 5 MRIs,
Okay.
and So I've seen probably about 10 doctors. In fact, the last doctor I saw said I would need to go to Mayo.
Okay. And who did you see? Was it an orthopedist or a chiropractor or your GP?
The last doctor I saw was Dr. Engel,
Okay.
and he is out of that big orthopedic complex.
Okay, all right. And was he the one who recommended your last MRI then?
Yes.
Okay. And how long ago did you have that taken? Do you remember?
Oh, yes, I do, because it hurt so bad having that MRI 3 weeks ago.
3 weeks ago? Okay. Do you have your films with you, Jennifer?
Do I have all
Do you hear
5 of
Rachel's
my
tone
films? Do you
though?
think
Like
the doctor
caring,
wants
like
all 5
she adds it.
MRIs?
I would definitely tell you we need to have you bring those along.
Having a nice, even tone with the patient and changing your inflex in your voice causes the patient to know that you understand what they're saying to you. For example, if someone says, that hurt really bad, or that was horrible, they want you to acknowledge back that you understand, that you know they're in pain. Use this to your advantage. Follow your own instincts. Be intuitive on the call.
Let me do this, Jennifer. I'd like to give you kind of an overview about our facility, okay? What we offer here is axial decompression, and it's a treatment that's designed specifically for chronic low back pain, sciatic pain, herniated discs, and failed back surgery pain in appropriate conditions.
Rolling through this with confidence is important. You just roll into the appointment, you just roll through the insurance information, but doing it with a genuine ability of you. You cannot be fake during this part, you have to be real. You have to truly care for the outcome of the patient when you're talking to them. If you're not, they can feel it.
Now, I know you said you've had 5 MRIs and you've seen a lot of doctors. Have you had surgery before?
I've had 3 surgeries and they're recommending a 4th. And, I really don't want that because every time I have surgery, I feel better for about 2 weeks. And
Okay.
then, it's pain again.
And then it comes right back?
Yeah.
When was your last surgery, Jennifer?
A year ago.
A year ago? Okay, and who performed that for you?
Dr. Smith.
Dr. Smith? Okay, and do you remember what they did?
Well, yeah, they just went in and cut the disc off.
Okay, so they trimmed the disc.
It's important to be able to handle the patient and be knowledgeable on the phone also. If the patient states, they cut my disc off, you can come back and say, they trimmed the disc. That's a more professional way of handling it. So you sound like you know what you're talking about.
Okay, and you said you got temporary relief and that was about it?
2 weeks, and I have been on, I've been on pain medication for about 5 years. I see Dr. Hiller for pain management, and he wants to take me off of all my, prescription drugs. I'm on about 10. Do you think when I come I should bring my whole list of medications?
I would definitely do that because that's going to be very beneficial information for Dr. Bush to look at so that he's aware of exactly what you're taking and how much you're taking, and we'll see if we can't get you off some of that.
Do you think doctor would even want to know that I'm on, blood pressure medicine too?
You'll definitely want to bring any medications that you are on, and again, you'll also want to bring any films that you can with you. Basically, the more information that you bring for Dr. Bush to see, the more accurate information he can provide to you. Now, what I'd like to do again is I'd like to go ahead and schedule you in for your first visit. I can get you in tomorrow if you're available and you have your films. I know you said you did. Could you do an 8 o'clock tomorrow?
Well, hold on, I gotta check with my husband on that because, he has to drive me everywhere. So, hold on, I gotta ask him.
Okay, sure.
Yeah, my husband said he can take me tomorrow.
Okay, so
but
we can...
my other question for you is, he wants to know real quick, do you take Blue Cross Blue Shield?
When you're on the new patient phone call, if the patient is trying to address an insurance question with you, you can let them know, I'm going to go into that with you in just a minute. Following the script is important. Making sure that you have your answers down and controlling the call will help you with a better outcome. If you control the call and get the information that is necessary to have the patient understand that they have a condition that's not going away, that they are getting temporary relief, when it comes to the insurance part, it's easy.
Actually, I'm going to go into that with you, okay? What we would do initially would be to schedule you in for your first visit tomorrow. On that visit, Dr. Bush is going to perform a preliminary examination, which would consist of an orthopedic, chiropractic, and neurologic evaluation. He's also going to get kind of a case history from you as well, okay? Now, since you've had current films, he won't need to do new ones, and that's why I'd like for you to bring those MRIs in with you, since you do have a very current one.
If a patient wants to know about fees, that's really easy. You just let them know what their fees for their first visit is, and you follow through with that. Because success starts with follow through. You have to make sure that if you're handling the fees and you're telling them the fees are going to be $160, when they come in that the fees are $160. If you tell them that they're going to have an exam and possible x-rays, you need to make sure that they know that. If you tell them only that they're going to have an exam, and then they come in and Dr. Bush says, well, you need x-rays, you did not follow through on what you said. You start off your care with a problem right away then. So letting them know, if their x-rays are old, they will need to get x-rays at your office and their exam, and letting them know the fee up front.
Now, fees are handled.
So for example, when you're on that call, and let's say the patient has a cervical problem, let's say they have a lumbar problem, and let's say they possibly have to have x-rays of the neck and the lumbar, you need to let them know, if they're mainly calling about their lumbar, you can say, I know for sure that Dr. Bush will want to take films of your lumbar spine, but if you want Dr. Bush to address your cervical spine, there would be a fee for that x-ray also. Because you don't want to have them get here and all of a sudden they weren't prepared for the fee for the cervical spine. And in the past before, because a staff member didn't prepare a patient for something, we've actually done the film and not charged. Because you don't want to start out a situation with letting somebody think that you didn't do something right. That just taints your whole time. It taints everything, the final everything.
Well, at the time the services are rendered. So what I would have you do is bring your insurance card along with you. As a courtesy to you, we do check your benefit coverage.
And everything's
and
a courtesy.
We would actually provide you with a copy of your receipt so that you could forward that to your insurance, and then any reimbursement that's due to you would actually come to you at home. It's very easy, and we'll show you how to do that, okay?
You'll notice that Rachel's tone actually goes up during the insurance information part. She raises her tone to a very peaceful, nice voice, and she's also going through and using the word courtesy. Because it is a courtesy that we are going to contact the patient's insurance company, considering they're the one that has an agreement with the insurance company, not us. Now, we do make it easy on the patient, and we let them know that we are going to teach them to do this. This is very easy, I can assure you.
Now, I do have you scheduled in. I'm going to put you in for tomorrow at 8 o'clock, okay? I'm going to need you to arrive about 20 or 30 minutes prior to your visit so that we can go ahead and get your paperwork filled out and get you back promptly at 8 with the doctor. Now, I know you did mention that you had a list of medications. If you could also jot down the dates of your surgeries, that would be very beneficial as well. That'd be kind of a time saver for us. We can just make a copy of that list, okay? And are you familiar with where we're located?
Yeah, my husband just said, are you the one next to Michael's Photography?
We are, okay? So
And he
you're
wants
obviously...
me to ask you also, is this traction?
Well, there's actually some very distinct differences between traction and axial decompression, and Dr. Bush is actually better at explaining that. So I'd actually like to let him take a look at you and find out if this is going to be an option for you, and then he can actually go more into detail with you about those differences. I'm not real good at that on the telephone, so I'll go ahead and let Dr. Bush handle that with you, okay? But again, the biggest thing we need to find out is whether or not doctor's going to be able to help you.
Not all patients are accepted for care.
We tell
the
the
doctor needs
patients,
to determine
not all
if
are
that
accepted.
patient has the type of condition that can be helped, and if that patient is serious and sincere about getting well.
Okay, because again, not all patients are accepted for care here. If doctor doesn't think that you're going to get substantial relief from this, he's not going to recommend it. Okay, now if he doesn't feel that he can help you, Jennifer, he would certainly let you know what to do from here or whom to see. Okay, he's very straightforward with his patients, and that's a big part of why we have the success that we do. Okay?
Okay, now, what's the date tomorrow?
We're
What time?
reputation building. I don't know if you've noticed, but we're reputation building the whole time on the calls. Yes, the more information you can provide, the best. Dr. Bush is very thorough. We are just, everything we do in the clinic is reputation building. From the time we take this first call to the last day of their DRS program.
And
We've got you in tomorrow, which is Tuesday, the 29th. We've got you scheduled in at 8 o'clock. And again, you want to arrive just about a half hour before that so that we can fill out your paperwork and get you back right on time with the doctor.
When confirming an appointment with the patient on the phone, what you need to say is the day, Tuesday, March 29th at 2 o'clock. The reason we do that is because some people remember their hairdresser appointment by Tuesday. Some people remember their doctor's appointment by March 29th. We just cover all the bases at one time. Tuesday, March 29th.
okay.
Okay?
Well, thank you.
You're very welcome. We look forward to seeing you tomorrow, Jennifer.
Thanks.
Thank
Bye-bye.
you. Bye-bye.
When ending the phone call, you need to make sure that you're letting the patient know that you look forward to seeing them. That lets them know in their mind, somebody out there is looking forward to seeing me. The sad thing about chronic patients is, a lot of times these patients, by the time they get to you, they're in a miserable marriage, and their own families do not want to be around them. If If you let somebody know that you're actually looking forward to seeing them, you have a better outcome of patients actually showing up for their appointment. You'll also notice that Rachel walked the patient through the first day. When you're on the other end of the phone, if you're thinking about what you're going to be doing and you can see it in your mind, you are more apt to actually follow through with that. So by walking them through their first day and telling them what they're going to be doing, that patient will show up and they will participate.
Did you see the differences between acute, semi-chronic, and a chronic call? And you can see, like, what type of calls do you take right now?
I
Do
would
you-
say over, what would you say? I mean, on the phone, I feel like over 90% is acute.
Acute.
Yeah.
Yeah.
Now when
I
they
was
get
getting
in,
PTSD listening to those first 2 calls.
Yeah. You were?
Oh,
I
absolutely.
kept hearing you. I was like, what?
I mean,
Do you take the calls?
No, I
Okay.
did not.
Okay. Do you take all the calls?
I do not take all the calls because
It's between you
it's
and,
between myself and the other front desk. And then
which is
also
the one who's been
because-
with you for 10
yes.
years? Okay.
And then also because there are times when I have to leave to
For the
be
kids?
mom.
Yeah. Okay. So once you start marketing though, I mean, right now, when you said do you have you have an axial decompression table yet?
Nothing yet.
Okay, so that's coming. Yeah, Dr. Bush will help you with that. But you're going to be marketing to the chronic, and I can promise you, it's so much easier than those acute calls. So much easier. The chronic calls are because you care about people, right? Right here in your heart, you care about them. That's all you're doing. These people, unfortunately, people just are armed and they have bullets all the time. Does that make sense?
Yes.
Even on that first call.
Yes.
All we want to do is you just want to take the bullets out of their gun, starting at that first call, because you want to help them help themselves. Jerry Maguire had it right. Help me, help you. Just think about that for the patient. If your heart's in the right spot on that call, the patient will know it. If you can train your staff to actually have that heart where they are taking that call and they care, following this script, and yes, you need to change your inflections because you're conveying an emotion. And again, we're animals. We're going to pick up on emotions. The call will be very easy for you. Now, this is what I do when I train my staff. I have them actually think about their grandma, or have them think about their grandpa or someone they're really close to. And I tell them, just pretend that every single patient is your grandma. And just get that little warm butterfly feeling about that patient. So how would you want your grandma to be treated? That's what you want them to do on that call. That's what you want them to do in the new patient paperwork. That's how you want them to do when they're handling them on the tables or in the rooms or anything. And everything, they need to just know that feeling. So right now, I'm going to go through scheduling then the new patient okay? So what are your work hours? What am I working with? Are you going to be
8 to 12, 2 to 6, Monday, Tuesday, and Wednesday, 8 to 12 on Thursday.
2 to 6? Okay.
8 to 12, 2 to 6, Monday, Tuesday, Wednesday, 8 to 12 Thursday.
Okay, so how many treatment rooms do you have for tables?
2.
Adjusting tables, right? Okay. Okay, and then do you have an exam room?
Yes.
Okay,
Yes, ma'am.
so this is treatment room 1. This is treatment room 2.
The way the office is laid out, when you come in, there's 2 hallways.
Okay,
Down facing the front desk, down the left hallway, it's consultation, adjust 1, adjust 2, exam.
okay, great.
Bathroom. Down this hallway, there's 2 rooms. Now what we're planning on doing is we're planning on switching. So
Okay.
I got to figure this out because I don't have enough rooms, but I'm hoping to make consultation, exam, report, the main room here.
Mm-hmm.
Decompression, 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 and then adjust on this side. Cause
I think that
have 2 rooms on
sounds
this
good.
side.
Does it sound overwhelming to you right now?
We got that part. We've been
Yeah.
talking about that
Yeah, I
part.
was gonna say.
It's good you guys are such a team. Tomorrow, can I have you draw it out for me on one of these?
Yes.
That would
yeah,
be great.
absolutely. I mean, if there's a break or something,
Yeah,
I
we'll
can do it
yeah,
on the break.
perfect. Okay, so we have treatment room 1, treatment room 2, exam, and then DRS. We're just gonna say 1 table DRS right now, okay?
That's where we're starting,
Yeah.
yes.
Yep,
ma'am.
okay.
Yeah.
So,
Those three.
how do you book your patients on the 15-minute for Cairo?
This,
For
this is
Cairo.
a really good question because we run
Just want to know how many you do right now.
No, like, do you book every 15 for?
3 every.
3 or 15.
Yeah,
So
okay.
if it's just adjusting, we can see 12 an hour.
Perfect. Okay, so let's just do this. Okay, so now this is your exam new patient,
I'm real anxious to see how.
X-ray. This column would be X-ray, exam, new patient, finals, first. We're going to start with that, okay? Then this is DRS, and those are going to be every 25. Okay, so over here. Now, we're now just going to strictly talk about new patients, finals, and first reports, okay?
New patients, finals, first report.
Yes, okay, so ring, I just finished with this call. I booked the chronic patient. Now I have to go into, do you have a software system for booking? Okay.
NexiSoft.
Okay, so you're gonna go in and you're going to make your new patients on the hour, okay? So you're always gonna book your new patients on the hour. So let's say you just got off the phone with Betty and Betty wants to come at 9 a.m. that day, okay? So right now this is Betty and she's a new patient. Can you color code your new patients?
Yes, ma'am.
Betty's gonna be red because red is new patient. So you're gonna have Betty, and then you're gonna have that she's a new patient, and it's gonna have her name. Is she low back, cervical, and her telephone number, okay? Now, that's red. Now, in between, we're gonna pretend that this is a new day, and this is Betty, number 2, and now old Betty that you saw the other day now has a final. Now, a final is, I'm gonna explain that to you. Dr. Bush sees them. Let's go back to the chronic patient real quick, which would be book 1. Go to the chronic patient, would explain, that's going to be the last page. Okay, do you see how it says, and Dr. Bush is going to go over all this. This is just a little brief introduction into it.
Okay.
Do you see where it says chronic chiropractic patient, chronic DRS patient? What you're going to do on the first visit, they're going to have their consultation and conference. They're going to have an exam and X-ray, and Dr. Bush will go through what's the grading scale, and then they will be scheduled to return the next day for a final report. That's the same for a DRS or a chiropractic patient, okay?
Okay.
So now, Betty, that came in the day before, was a new patient at 9 a.m., but now you have a new Betty the next day. This is the next day, okay? This is
Day
pretend.
2 Betty.
Yeah, this is day 2. Now you have a new Betty. So this is a new patient you have at 9 a.m. But now, Betty, that you're checking out as a new patient, doctor wants to see her tomorrow for a final report. So Betty needs to come in. So now you're going to say, Betty, and we go through all this when we train you on the videos. Betty, Dr. Bush wants to see you tomorrow to go over his findings. And at that point, then you're going to book your finals, which are going to be yellow, on the half hour. This is where the doctor gives his report of findings. So what you really want to see in your book is red and yellow, red and yellow, red and yellow. Because what's red and yellow? New patient, final. New patient, final. That means, great, you have a new patient. This is where you're presenting your treatment plan. Now, let's say it's a chiropractic patient and you want to just do some trial treatments, okay? That's what's called a first report. And we go through all this with you. First reports are booked on the 15-minute. And you can still see all your chiropractic patients at the same time. Over here. If you have somebody that's going to get their, do you do blood pressure and all that? Or do you have a nurse? You have a person?
As of right now, our day one, after the case history,
Yeah.
I do bilateral weight distribution, I take posture pictures,
Great.
and I do my chiropractic evaluation and
Okay.
adjust.
Okay, on day one. Well, we're changing that for the DRS patients. So this patient, you'll have to just know you're going to want to. That's why I'm just giving you a brief. You're going to want to book your new patients on the hour, and the final report, which is yellow, which is that's where you're going over their finding is what your recommendation for care as far as DRS will be on the half hour.
Okay.
Okay. Now, how you do it in between there to get yourself acquainted, figured out, because I don't know how you're how quickly you're moving. I'm just going to focus only on DRS. So let's just know that it will be based on that based on, if you go to our page here, let me show you. It shows you.
I think that's what hour or just 1 hour?
I'm about to ask. She's still laying out her plan.
One new patient an hour.
So they're booked for an hour.
Correct.
So are your new
Yes.
patients in your computer, your reds, they're a 60-minute appointment?
Yes.
Okay.
Yes. So it would be, so like what Dr. Bush likes to see is, I have a new patient at 8. I have a new patient at 9. In between here, he could have a half hour, he could have a 10 o'clock final. Then he could have a 10:30 final. Then he could have a new patient at 11. Then he could start at 1 and he could have final, new patient at 2. You want to see like controlled chaos so that it's not out of control for you. Does that make sense?
Yes, ma'am.
Is it confusing to you?
Yes, ma'am.
Okay. I just want to take you upstairs and show you.
Okay, that's not a problem.
Yeah.
This was one of the big things I wanted to handle, especially with you.
Yeah.
I was excited to have this conversation. We run what I call a linear schedule.
Okay.
So, for example, we don't have set times when we schedule our new patients, but we have set amounts of time on my schedule that's taken out. So, for example, on Monday, you might see from 8 to 9 is nothing but adjustments.
Okay.
We're at 8, 15, 30, 45. Then at 9 o'clock, the first new patient comes in. So they'll come in at 8:30, and then at 9 o'clock, they're prepared to see me. A chunk of my half an hour is taken out, so no one else is scheduled from 9:15.
Okay, so they don't
9:30.
book any
Nothing else
adjustments.
is
We
booked
wouldn't have
because,
adjustments booked during,
right.
Okay.
it's either exclusively adjusting
And
or exclusively new patient.
Okay.
Or exclusively
Linear.
report
Yeah,
of findings.
right,
We
down.
call them ours are NPs for new patients.
Yeah, that's what you mean. Yeah.
And our ones are people that are coming back for their first
Yeah.
report of findings.
Yes.
And then we do re-exams.
Okay.
But they're just 5-minute appointments, so they go in with regular adjustments.
Okay.
And then
I wanna
a re-report.
He's gonna show me.
fix
Oh,
this.
he brought them.
Yeah, I want to fix this. This is Monday. This is
Okay.
Monday when we go back to the office. So this is what the schedule would look like. So these are all adjustments, and then 9:45 is when I'll see my first new patient. And in this
But
shift
they'll be
here,
there at 9, they'll have already filled out all their paperwork.
They're gonna show up at 9, but you're telling him
or
it's on.
9:15 rather.
Right, and then they're on his schedule when he is physically.
So they're sitting in the consultation room when I'm done with these 3 people, and then so these 3 people will show up at 9:30, adjust. 9:45, I go right into the consultation room and I start consultation, and then we don't have anybody scheduled here, so I'll have a little bit of a break and go right into the 10:30. It
Okay.
doesn't look like I have anything else to show you. These are just adjustments and new patients this particular day, but I might have a 15-minute blue where I got a day 2. So I'll do adjustments, I'll go into a day 1, and then move into what you would call a final report on.
Do you mind if I just walk him upstairs? Can I walk you upstairs?
Of course.
Okay.
Yeah.